Hi, thank you for joining us today. We're going to launch today our Georgia cAARds program webinar series. My name is Keith Bussey. I'm here with my colleague, Dewana Calhoun, and we both work on behalf of the Georgia Department of Public Health. So I'm going to start a conversation around what the Georgia Tobacco Quit Line entails, which is an integral part of the Georgia cAARds program. Then I'm going to hand it over to my colleague, Dewana, who will provide the history of the program, the shared national goals around the program, and next steps. So, regarding the Georgia Tobacco Quit Line, I'm going to go over smoking prevalence rates and statistics for the state of Georgia, what is a quit line, and more specific information around a patient or caller experience once they dial the Georgia Tobacco Quit Line number. Smoking prevalence rates here in the state of Georgia tend to be a little higher than the national average. For males, it's 24%, where it's 22% nationally. For females, it's 18%, where it is 17% nationally. Approximately 1.5 million Georgians smoke cigarettes, where about 317,000 use smokeless tobacco products. When it comes to Georgia's youth, those aged from 13 to 17, we have about 23,000 middle school students that use tobacco products, where we have about 73,000 high school students who use tobacco products. So, what is a quit line? A quit line is a telephone-based tobacco cessation counseling service that's available to any person in the state of Georgia free of charge. Quit line services are available throughout the country, all 50 states, including DC and Puerto Rico. A quit line is a great way for someone that's willing to make a quit attempt to call in and get the professional grade help that they need. Anyone can call the quit line. It doesn't necessarily have to be anyone who smokes tobacco or who uses tobacco products. It can be a relative, a friend, or a healthcare provider that's seeking information on behalf of the tobacco user. So, the Georgia Tobacco Quit Line. The Georgia Tobacco Quit Line is a public health service that's provided by the Georgia Department of Public Health through the Georgia Tobacco Use Prevention Program. The Quit Line provides free and confidential information to any resident of the state. Any Georgian that's age 13 or older can call the Quit Line. Pregnant, postpartum women can call the Quit Line to get the services they need, as well as just regular Georgian adults. Quit Line services not only address those who smoke cigarettes, but those that smoke all tobacco products. The Quit Line is available 24 hours a day, 7 days a week, including major U.S. holidays. Also, there are Quit Line interpreters to help with any Georgian that may speak languages outside of English and Spanish. So let's go through what entails the experience of a patient or caller who dials the Quit Line number. Once someone dials the Quit Line number, a registration intake specialist will take basic information from them in English or Spanish, their name, their address. They will explain the services to them. They'll assess the caller needs and determine whether or not they are ready to quit. In the event that a caller is ready to quit, they would be transferred live to a quit coach. If not, then the registration intake specialist provides more information and encourages the caller to dial the number back at a time when they feel that they are ready to move forward. So once the registration process ends, the caller or patient is transferred to a quit coach. The quit coach spends about 25 minutes with the caller going over basic information like tobacco use history, the number of times they've tried to quit previously, the longest time they remain quit, and any reasons around why they were not successful. The quit coach takes that information along with determining the level of motivation and the self-efficacy of the patient or the caller, and they build what we call a quit plan. That quit plan, based on what the quit coach and the caller discuss, has information around, information that they need to track tobacco use, information around creating what we call mini quits, which are minor steps that the quit coach and the caller take together to make sure that they are successful in their quit attempt. Also, the quit coach provides educational materials, print educational materials, that can help him or her with going through the process of quit. For those callers who enroll in the tobacco cessation services, as well as the nicotine replacement therapies, or NRTs, in the form of patch or gum, they provide basic dosing information around that. So, the Quit Line experience involves 4 follow-up calls. These follow-up calls are delivered at times deemed appropriate by the quit coach and the caller and patient. So usually the first call is provided around the quit date that the coach and the caller agree upon together. Then another call is given sort of a week or so after the quit date, and then 2 or 3 additional calls are scheduled in accordance to what the quit coach deemed appropriate. That varies from caller to caller because different patients or callers have different needs. Usually during these calls, the quit coach and the caller would go over their status, their progress, how things are going, how they're best coping with urges, and give them strategies around dealing with barriers or urges. And the quit coach sort of reiterates that the caller can dial back anytime that they need in order to get any help with urges or more information about whatever involves the quit process. So very quickly, I want to go over some benefits of the quit line. Quit lines are accessible and efficient. Anyone can call the quit line any time of day. You don't have to meet for any classes. You don't have to travel to any location for classes. Usually those that are underrepresented in Georgia, minorities or low SES, they are able to call the quit line and get the help that they need. And it's also helpful for those who may have a problem or may not feel comfortable with talking about their tobacco use in a group setting. Moreover, the Georgia Tobacco Quit Line offers two types of services. We have the proactive services, which entails the Georgia Tobacco Quit Line calling a patient in the time slots that they make available when you and your patient fill out the healthcare referral form together. So at the bottom of the form, there are time slots that the caller can choose to tell the quit line when it is best to call them. Outside of that, outside of the scheduled time, a patient or caller can dial the quit line at any time if they have any immediate urges that they may think they can't overcome, or if they just want to get more information from their quit coach. So the Georgia Tobacco Quit Line provides services for the healthcare provider as well. Once a caller or patient decides to enroll in the quit line program, a patient's outcomes report is generated. This report captures pertinent information about the quit line experience, such as whether or not the caller decided or patient decided to enroll in services, whether or not they declined services, the type of cessation services that they decided to take up, whether or not they do the single call, the multi-call, whatever the planned quit date is, and information as such. So as you see here, there are 3 different lines to the Georgia Tobacco Quit Line. We have a number for English-speaking Georgians, those that speak Spanish, and for the hearing impaired. And on the screen here, we have a sort of compilation of all the free promotional materials that are available for the Georgia Tobacco Quit Line. So if you or any staff member within your organization would like any of these products, just feel free to reach out to me at any time. You can find more information about our program or the Georgia Tobacco Quit Line on the DPH website. So if you were to type in dph.georgia.gov, it would bring you to this page. And a very quick way to the quit line section of the website, you can see here on the rotator, just click number 4. It will bring up the sort of promotional image for the quit line. You click read more, and it directs you to the Georgia Tobacco Quit Line webpage. And as I mentioned earlier, there's more information here about what the quit line entails, benefits about smoking, benefits of using the quit line, and at the bottom under related files, there's more files that you can download to help you and your practice learn more about the quit line. Also here from this page, if you were to scroll up, look to the left side of the screen where it has Georgia cAARds, you can click this link and it'll provide a brief overview of what the Georgia cAARds program entails. There's a YouTube clip here about a healthcare provider speaking to the program. There's more information on here. My contact information is here just in case you want to reach out to me. And as with the other page under the related files, there are files stored here that you can download. They help you and your staff sort of implement, adopt, and execute the program. So to talk more about the Georgia cAARds program, I'm going to hand it over to my colleague, Dewana Calhoun. Dewana?
Yes, thanks, Keith, for the introduction. So we hope that by the end of this presentation that healthcare providers, public health providers, as well as employee health professionals attain the additional knowledge, information, resources, and skills to maximize the routine delivery of evidence-based tobacco cessation interventions. So the webinar series will be posted, as Keith mentioned, on the Georgia Department of Public Health website. So let's get started. The good news is that the majority of tobacco users say they want to quit. More than half of tobacco users throughout the United States try to make a quit attempt each year. And in Georgia, approximately 1/2, or 54% of adult tobacco users, or nearly 520,000 adult tobacco users in Georgia, made a quit attempt in the past year. So your commitment to supporting tobacco cessation interventions by taking additional steps to support processes as well as to support all tobacco users statewide is so important, because smokers cite a healthcare provider's advice as an important motivator to quit smoking or to quit tobacco. So the Georgia cAARds program is designed to align with the Healthy People 2020 national objectives, which are 10-year science-based and evidence-based objectives designed to improve the overall health of all populations. One example of the Healthy People 2020 national objectives is tobacco use number 9, or increasing tobacco screenings in all healthcare settings. So the tobacco, as well as the Task Force on Community Preventive Services, recommends that an intervention be comprised of educating and prompting healthcare providers to identify as well as to intervene with patients who use tobacco. And when we suggest that these strategies be implemented consistently in order to increase the number of tobacco users who quit, which is really wonderful. As a result, the 3 components of the Task Force on Community Preventive Services recommendations include healthcare provider reminder systems, as well as healthcare provider education and patient education. In addition to providing support to address Healthy People 2020 national objectives, in order to improve the overall health status of all tobacco users, the Georgia cAARds program, or Ask, Advise, and Refer with Follow-up program, is designed to align with additional national standards and measures. So, for example, healthcare professionals addressing standards 2, 3, and 4 within the patient-centered medical home model may find the Georgia cAARds program resources beneficial to all members of their healthcare and public health team. But in another effort to address Healthy People 2020 national objectives related to health disparities associated with tobacco-related complications as well as diabetes-related complications and mortality rates, the Georgia cAARds program aligns evidence-based models and health system changes supported by community resources such as the Georgia Tobacco Quit Line to reduce factors such as smoking rates among all tobacco users, including members of vulnerable population groups such as pregnant and postpartum women, as well as tobacco users who are diagnosed with chronic conditions. So why was the development of the Georgia cAARds program so important to us in Georgia? So in Georgia, approximately 1.5 million adults smoke cigarettes, and approximately 96,600 adults who are also diagnosed with diabetes smoke cigarettes alone. So let's find out a little bit more about how the Georgia cAARds program evolved. So the history of the Georgia cAARds program is based on the California's Do You Card campaign, which was a collaboration between 2 California Department of Public Health state programs, the California Tobacco Control Program, as well as the California Diabetes Program, and supported by the California Smokers Helpline, as well as the CDC's Office on Smoking and Health. Its major partners included California's Medical Association Foundation, as well as the American Association of Clinical Endocrinologists and the American Association of Diabetes Educators. So in a similar fashion, the Georgia cAARds program is a multifaceted educational program that's the result of a collaboration between the Georgia Tobacco Use Prevention Program and the Georgia Diabetes Prevention and Control Program. So it's designed to further support healthcare providers, mid-level practitioners, and other clinicians and members of the public health team with implementing the routine delivery of services to all tobacco users. So the goals of the Georgia cAARds program include increasing quit rates among all tobacco users, including pregnant and postpartum women, as well as adults with and without chronic conditions. The Georgia cAARds program is also designed to increase the routine delivery of stage-based interventions during every visit and every patient encounter. The Georgia cAARds program framework includes community resources such as the Georgia Tobacco Quit Line services, as well as healthcare provider resources and technical assistance and patient or provider educational materials. So a few examples of the Ask component within the Georgia cAARds program include screening all patients for tobacco use and documenting tobacco use type, frequency, duration, as well as current triggers. So it may be helpful to also document a patient's previous medication history related to tobacco quit attempts. A few examples of the advice component that are outlined in the Georgia cAARds program includes advising patients about their health risks associated with tobacco use, but also balancing that discussion by providing patients with other benefits associated with quitting tobacco and assisting patients with exploring or identifying their personal reason for quitting. So for example, for patients diagnosed with hypertension, it may be helpful to share with them how tobacco cessation may improve their blood pressure control and reduce their risk for heart attack or stroke. Or for patients diagnosed with diabetes or prediabetes, the same applies. It may be helpful to share with that patient how tobacco cessation may improve their glucose control. A few examples of the refer with follow-up component outlined in the Georgia cAARds program includes referring all patients who use tobacco products to the Georgia Tobacco Quit line for additional services and support, and equally important is following up with patients during their next physician office visit, the next telephone encounter, as well as any type of email correspondence. So the benefits for participants regarding the Georgia cAARds program includes participants receive free materials, including the Georgia cAARds reference manual, which will be featured in an upcoming webinar, as well as a customized Georgia Tobacco Quit line referral report. Several settings are ideal for the Georgia cAARds program. In some cities and towns, the same patient may be seen in one setting and then referred to another setting for additional comprehensive care and support. So the Georgia cAARds program was designed so that regardless of the setting, providers and members of their support team are exposed to the same information and standards in about the same time and are able to utilize case studies from other locations as a reference to meet or in some cases exceed those expectations or standards. So you may be wondering, oh, my organization is interested in becoming a Georgia cAARds program partner or site. What is the process? Please feel free to contact me or my colleague here, Keith Bussey, at the Georgia Department of Public Health for additional information regarding enrolling in the Georgia cAARds program. And we welcome you to also visit the Georgia Department of Public Health website for additional information as well.
Thank you, Dewana, for your overview of the Georgia cAARds program. Now I would like to direct your attention back to the Georgia cAARds program website. On this website, as Dewana mentioned, you can find additional information about what the cAARds program entails. There's a YouTube clip here of a healthcare provider talking about the importance of the program, what it entails, and how best it can help your practice. At the bottom, we have a section called Related Files, and these are the files that Dewana mentioned about. They're free of charge. You can download them. They'll help you with learning more about the program, adopting the steps of the Georgia cAARds program, as well as empowering your team to roll out and execute the Georgia cAARds program. And again, as Dewana said, please feel free to reach out to me. My contact information is right there on the screen, and we'll be more than happy to accommodate you and your healthcare team with rolling out the Georgia cAARds program. Thanks again for watching this webinar. Stay tuned for future webinars. The very next webinar in the series is the Georgia cAARds reference manual webinar, where we go over what the reference manual entails and how best you can use it to empower your team to roll out Georgia cAARds. Thank you.